Welcome to Dr.Yousif lectures, and today's lecture about CHADS-DS2-VASc Score. And before starting this lecture, it's my request to kindly subscribe this channel and hit the bell icon so you get the notification for new videos. And what is the CHADS-DS2-VASc Score? Basically, CHADS-DS2-VASc Score helps to determine the stroke risk assessment in the atrial fibrillation patient. Means just this VASc score helps to determine the stroke risk assessment in the atrial fibrillation patient. So when we just assess the risk about the stroke in the atrial fibrillation patient, then we can give in the antithrombotic drugs or the anticoagulation drugs. So how can we give direct oral anti-therapy on the basis of CHADS-DS2-VASc score? So what is the CHADS-DS2-VASc score? Basically, the CHADS means the C means the congestive heart failure, and the left ventricle ejection fraction, and its score is 1. Hypertension score is 1, and age. Now see, if age is greater than 75 years, then the score is 2. But diabetic patient score is 1, stroke score is 1, vascular disease score is 1, 65 and 74 years score is 1. Here important thing is that when the age is greater than 75 years, score is 2, but when the age is 65 to 74 years, the score is 1. This is a main thing that will be mostly understand the and mostly ignore this thing, and we cannot calculate the CHADS-DS2-VASc score. And sex category is a woman, is a 1. Okay, now let's be talking about how we can give in the anticoagulation therapy. If the CHADS-DS2-VASc score 0 in men and 1 in female, then no need for the anticoagulation therapy. But when the CHADS-DS2-VASc score 1 in men and 2 in female, then give a direct oral anticoagulation therapy like the Epixaban and Dabigatran. And if the CHADS-DS2-VASc score 2 in a man and 3 in female, then give direct oral anticoagulant therapy like SAM, Epixaban and Dabigatran. Then let's calculate the case study that how can you calculate the CHADS-DS2-VASc score. For example, if the patient 78 years woman having the atrial fibrillation with a congestive heart failure and hypertension, calculate the CHADS-DS2-VASc score. So here 78 years means if the patient having the age greater than 75 years, score is 2. So means now this is a 2 score. But when the patient having the congestive heart failure patient, score is 1, and the patient has hypertension, score is 1. Now let's we calculate 78 years, score is 1, plus score is 2, plus congestive heart failure patient, CHF patient, score is 1, and hypertension patient score is 1. So total score 2 plus 1 plus 1 is equal to 4, and patient in women, so is a CHADS-DS2-VASc score is a 4. So we can give in the anticoagulant therapy or not? Yes, we can give in the anticoagulant therapy because the score CHADS-DS2-VASc score is 4. Now let's see, in the 65 years women having the atrial fibrillation patient with a congestive heart failure, hypertension, calculate the CHADS-DS2-VASc score. 65 years women, here the 65 years women means here score is a 1, because between the 65 to 74 years a CHADS-DS2-VASc score is 1, and when the congestive heart failure score is a 1, and the hypertension score is a 1. Now let's calculate 65 year score is 1, plus congestive heart failure patient score is 1, plus hypertension score is 1. So total score 1 plus 1, 1 plus 1 is equal to 3. So CHADS-DS2-VASc score 3. So we can give in the anticoagulant therapy because here the 4 score, here is the 3. So we can give in the CHADS-DS2-VASc score, and we can give in the anticoagulant therapy into these to both patient. So this is all about today's lecture. If you have any query about this, you may ask into the comment box. Thank you, Allah Hafiz.